So the Minister of Health, Dr. Louise Kpoto, is here. Dr. Louise Kpoto is here to meet with the aggrieved workers of ELWA. Dr. Louise Kpoto is here, and she's walking towards the aggrieved workers to have a word with them.
Okay, so folks, that's it. Right here, the minister is about to address the protesters.
First, then before we go to SIM, the entire represent, we can have everybody go into here. So you want for them to read it in their presence?
Yeah, I want to read in their presence.
So we need for them to come.
Yeah, they need to come.
They should come along. Or you want for us to go to them?
After reading this petition, before the press, presented to them, then we go in now for the dialogue.
Who are you giving the petition to them or to the government?
The petition here is to where we send it to government representative, which could be the Minister of Labor, Minister of Health, and then we also think about the board chair of SIM. Yeah, but since government representative here now, we send it to the government representative.
So my advice would be, go on the campus, you read a petition there because we have come to you to appeal to you, to listen to what you have to say, and then we're going to have the dialogue.
Yes. Then, if you don't want to say your opinion,
so I will have to listen.
Come on, Josh.
Gentlemen, as a president, we are sad.
Josh.
Gentlemen,
So the management, the management of ELWA Hospital is coming out to meet with the aggrieved worker with the intervention of the Minister of Health. Dr. Louise Kpoto. So the management of ELWA Hospital is here along with Dr. Louise Kpoto, the Minister of Health.
The majority of the media on the side.
Just being small. Yes, small, yeah. Open up small.
Okay, petition of the aggrieved workers of ELWA Hospital / Worker Union. With the theme, enough is enough. We want a new ELWA hospital. Presented today to the board chair / the country director / the government and a government representative, Ministry of Health or Ministry of Labor. Louise Kpoto, the legislature of the Republic of Liberia, Minister of Labor, Minister of Health, international community and diplomatic mission, civil society and human rights organization. Monday date October 6, 2025. We the suffering masses, as ELWA hospital workers, petition SRM Liberia and SRM International. On the historic day, October 6, 2025, we the staff of ELWA hospital as a sub-unit of the ELWA ministries, which comprises of physician assistant, nurses, laboratory technician, pharmacist, pharmacy technician, nurse aide, cleaner or janitors, all other support staff, and even contractor. Raised as one voice, we stand united, not in violence, but in peaceful defiance of the injustice, low salary, unnecessary redundancies of staff, misuse of donor forms, high-level salary discrepancy, and the plan of SRM Liberia to narrow down a 125-bed space hospital, which is providing services to approximately 200 Liberians on a daily basis. We raise because our backs are against the wall. Our institution, the ELWA hospital, is broken. The hospital lives on past glory. The futures of the employees of this great institution is in jeopardy, and our patience has run out. Whereas the godly grant of the ELWA hospital placed SRM Liberia and the board of directors in a higher decision-making position. The board of directors in SRM Liberia have the sole responsibilities to make final decisions on critical issues arising at the hospital. A responsibility which the board in SRM Liberia have willfully neglected. Since 1 year ago, we've been making all necessary efforts to resolve some major issues affecting the life of staff negatively with the management SRM Liberia at the hospital. The management SRM Liberia has paid deaf ears to our cry. We, being faithful citizens, communicated our concern to Labor Standard Division, Ministerial of Labor. The ministry responded partially to some of our concerns. Some of the issues still remain unaddressed. Today, under the leadership of SRM, who is the governing body of the ELWA ministry, the hospital, which is number one econ generation arm of ELWA ministry, is sinking deeper in crisis, marked by worsening low salary, few doctors, work overload, few doctors, physician assistants attending to large number of patients and long hours of work. Work overload as a result of unnecessary redundancies of staff and failure to replace resigned staff. High-level salary discrepancy. The suffering of the people has reached unbearable level. The hospital is bleeding. The stone pillars of disturbances grow deeper day by day. We cannot no longer remain silent while our rights are backed down, our future story, and our hospital going down the drain. Therefore, we the suffering masters of the ELWA hospital issue this petition with urgencies and resolve, demanding immediate actions on the following critical issues. Whereas, since taking office, the country director in presence of Nicholas has failed to demonstrate genuine commitment to the fight against the existing issues at the hospital, but instead making the situation worse for the staff, as well as draining the hospital in revenue generation. We want to categorically state that the missionaries are hiding behind the gospel to exploit the hospital. Serving in mission, SRN exploit the hospital in the tomb of $312,000 United States on a yearly basis for a purchase of electricity. This money is paid to SIN on a yearly basis. Whereas, buying current from Liberian Electricity Corporation is far less than what is being paid to SIN. A distant exploitation, a question to be answered. 1. Bad decision or negative decision at the hospital. Whereas, the country director and SIN Liberia in 2023 took a decision at her board meeting to close down the family medicine program from the hospital. The family medicine program is an NGO and government partner program providing higher and specialized training for Liberian doctors. The program was funded by NGO, not the hospital, neither SIN. That decision led to the withdrawal of 18 Liberian doctors, hereby reducing the manpower and increasing workload at the hospital. That decision did not only reduce manpower, but during the hospital patient intake, hereby decreasing the hospital financial intake and quality of care. Whereas, the female ward was closed a few weeks after the family medicine program was terminated. The decision to close the female ward created inadequate bed space for the hospital, subsequently jeopardizing the hospital financial intake and adversely affecting the Liberian citizens seeking care at the hospital. Whereas, the INGYN clinic were also closed in some part of this year. That decision brought more burden on the hospital financially. Whereas, SIN Liberia neglected the fact that Liberians who work at the hospital solely depend on the hospital for survival. Ignoring this fact, SIN unnecessarily redundant 11 men in May 2025. The redundancy of the 11 men created well overload at the hospital and poor quality of care at the hospital. Whereas, SIN Liberia has decided to reduce a 125-bed space hospital to a children's clinic. The current ELWA hospital was constructed by Samaritan Post Liberia through the influence of Franklin Graham and turned over to SIN for management. The current decision by SIN to close or reduce the hospital to a children's clinic clearly demonstrates SIN's inability to manage the hospital. This plan, when implemented, will deprive Liberians of job and health care, subsequently overburdening the government facility and increase in death rates. The hospital approximately attends to 150 patients per day, 4,500 patients per month, and 54,000 patients per year. The question is, when this plan is implemented, where will this number of people seek health care? We demand reversal of all negative decisions made by SIN Liberia, return our 18 Liberian doctors, reopen the female ward, reopen our clinic, and reverse your decision of narrowing the hospital to a children's clinic. Two, low salary. The ELWA hospital stands as one of the biggest hospitals in the Republic of Liberia with a second or third largest patient intake. However, the hospital remains the least paid hospital in the Republic of Liberia. A hospital like ELWA, run by a Christian entity like SIN, paying a professional nurse with a salary less than 30,000 per month is considered abuse of human labor. SIN Liberia and the hospital management are fully aware that Liberia is a country where 75% of the day-to-day transactions are done in US. Paying a family man less than 30,000, will such person be able to survive on their salary? A question to be answered. We demand immediate augmentation in wages to commensurate the living standard of a working person. 3. Stressful means of coming to work. The ELWA hospital funded in 1965 by the International Mission Organization serving in Mission SIN remains the second or third largest hospital in Liberia, providing variety of services to the public. The hospital has approximately 300 plus employees that come to work on a daily basis under stressful conditions such as getting on motorbike, keke, and commercial taxis. Recently, one of our colleagues in Possible, Barbara, was involved in a tragic motor accident where she broke her legs 2 times. This means of transportation for the staff is unbearable and life-risky. SI and the hospital management have failed over the year to procure buses for our staff, which could facilitate easier transportation and getting to work on time. Makes use of donor funding. Whereas SI International and St. Liberia, key figure in the management of the ELWA hospital, were giving approximately $75,000 United States dollars for the purchase of an amulet for the hospital to facilitate easy and safe transportation of patients among hospitals, hereby improving the quality of care at the hospital. The above fund was given since 1 year ago, but the amulet is yet to be seen. Therefore, we demand immediate purchase of the amulet. Our measures to the nation and the world. ELWA hospital dream is going down the hole as a result of SI inability to manage the hospital. Samaritan Poets built this hospital to benefit Liberians, not SI. Therefore, we are calling on Samaritan Poets to intervene into the matter after SI has settled her liabilities. The ELWA hospital is considered as His Excellency President Joseph Numa Boakai's hospital by many Liberians because before ascending to the presidency, His Excellency President Joseph Numa Boakai was seen many times taking treatment at this hospital. We as staff and citizens of this country are calling on the President, His Excellency Joseph Numa Boakai, to intervene in preventing the hospital from closing. We are in white every day, but not everything is okay. The name of the hospital is big, with more patient intake, but our wages remain the least among hospitals in Liberia. We ride keke, motorcycle, buses, and commercial taxis to commute to work every day. Our major demands: immediate reopening of the CBA for discussion, immediate payment of our retroactive benefits, immediate payment of our 30-minute lunch break. The management of SI Liberia should provide a clear account or explanation of how the $75,000 US donation for the ambulance was spent. A definite timeline for the remittance of our Social Security and LRA benefits. In this, signed Michael D. Dottu, General Secretary, approved Jeremiah P. P. Co-Chair, attested Bama D. Dogba, Chairman. In due, we will present.
It was the petition of the aggrieved workers of the ELWA hospital to given to the Minister of Health, Dr. Louise Kpoto.
We heard your concerns and we believe that they are genuine. We will ask that we have a dialogue with you, the board chair and the SIM that's here, the representation of the SIM. The Ministry of Health, we are here to listen, and we have listened. Everything he says is genuine. They are very, very genuine. So we want to have a dialogue and get back to your people with the decision that we have made as dialoguing with both parties.
Thank you very much.
How soon do we expect the dialogue to be resolved?
We are about to go now. So probably within, I don't know how long it will take because we have to hear from SIM. So probably within an hour's time.
So how soon do we expect for this to be resolved?
In an hour's time.
Right, that was Dr. Louise Kpoto of the Minister of Health. And she has received the petition from the aggrieved workers of ELWA hospital. So, ladies and gentlemen, we are still around here to hear from the management and from the Minister of Health.